Oral questions by members.
Leader of the Official Opposition.
Thank you, Mr. Speaker. The Premier has repeatedly dismissed questions about his government withholding critical data related to the management of COVID-19. He said, and I quote, "We're not hiding anything," end quote. Well, the Premier is hiding. He's hiding key data and information that the public is entitled to. Last month, this government was finally forced to admit that it had been keeping two sets of numbers on how many COVID patients are actually in hospitals. One for the public, and the accurate one is actually 46% higher. The majority of British Columbians want to do the right thing, but they need specific, detailed information to help them make better decisions, including choosing to be vaccinated. So, to the Premier, why is his government still failing to provide accurate hospitalization and ICU numbers despite making a promise to do so a month ago?
Minister of Health.
Thank you very much, Honourable Speaker. Thank you to the member, the Leader of the Opposition, for her question. Since the beginning of the COVID-19 pandemic, in March of 2020, was declared, and even before that, we've been providing British Columbians with information on a daily, sometimes on a weekly basis, through regular briefings, through our online dashboard, through multiple reports. For example, in terms of long-term care and assisted living and acute care outbreaks, information since January, weekly information on case counts, on the number of people who have passed away in outbreaks and so on. The amount of information that's provided on a daily and weekly basis is exceptional in BC. We receive new requests for different information all the time. The issue of discontinued isolation, as the member will know, in the community is a significant issue that we've been asked about many times. Just because you've recovered and are no longer infectious doesn't mean, because of long COVID, that you're not continuing to suffer the consequences of getting sick from COVID-19. So there is a massive amount of information and requests that goes out every day. I think to suggest, and I just disagree with the Leader of the Opposition on this, that this mountain of information and the desire to have more than a mountain of information is a reason for anyone not to get vaccinated is just not correct. People need to get vaccinated now, and I know the member agrees with that, so we're not having that debate, but I don't think that's a reason. We're providing on a daily, weekly basis. Today, Dr. Henry will be briefing again. We promised, I think, a couple of weeks ago, a monthly report on this school year and on outcomes of cases in this school year. Dr. Henry will be briefing in detail on that, and we'll be providing other information as requested as we expand to the hundreds of requests that we get every week from members of the media and the public with respect to the COVID-19 pandemic.
Leader of the Official Opposition, supplemental.
Well, certainly the minister can list off all the briefings and the information that is currently provided, but what British Columbians expect from the Premier and this minister is accurate information. People expect that the Premier will trust British Columbians with key information. It's not good enough to say there are daily briefings, there's information. It is what information is provided and how. Let's talk about attempts to get information about COVID-19 outbreaks in hospitals through freedom of information. Those have been stonewalled and denied. Fraser Health, for example, recently blacked out 55 of 79 pages in a document that was finally provided after months of delay. So the minister can, list all of that information. That is the fact. Fraser Health blocked 55 pages out of 79. Jason Woywada of the BC Freedom of Information Privacy Association says, and I quote, "Trying to hide behind redacted documents and not getting the information out there as quickly as possible can erode trust in public institutions," end quote. And that is exactly what this government's provision of details and detailed information has done. It has eroded trust. It should not take an FOI request to get detailed information about the COVID-19 situation in British Columbia. It shouldn't take an FOI request. So again, to the Premier, will he and his government provide the accurate hospitalization and ICU numbers that were promised? That is what British Columbians expect, and that is what they deserve.
Minister of Health.
In British Columbia, in a pandemic, the people who are responsible for providing accurate information is why we have a Public Health Act. It's why information is gathered under the Public Health Act, our public health. And I support every single one of their decisions because I support them. The Leader of the Opposition asks about requests for information, about cases of in hospitals, and about an FOI request that I think was made by media members. It is not surprising, and it's one of the real challenges of the pandemic sometimes. Because early on, a member will remember, there was the first case in Interior Health. People wanted to know where the person lived. And I repeatedly said, we're not going to provide that information for good and important reasons. The redactions, as I understand it, many of the redactions which were made by the Freedom of Information people responsible and the Fraser Health Authority in that case were made consistent with the Freedom of Information and Privacy Act. They made those things. Of course, there is a process for appeal of that process, and that may well happen. But it's not surprising that the details of case histories of hospital outbreaks fall under the privacy provisions of that act. And I think the member surely would agree that you would expect redactions from such a request, and redactions occurred. There is also a process to review that, and I know the members will be canvassing this in further questions. But that's the process now. We have an independent process. Independent people take a look at it, they respond to that, and they have in mind protection, the desire for information, which is critically important, which we do every single day on our dashboard, and every single week in our reports on outbreaks, and as well, they expect the privacy of individuals in our healthcare system to be protected.
Member for Abbotsford West.
Mr. Speaker, I think that through this extraordinary time, this pandemic, most people have endured. They have endured without complaint. They haven't been out protesting. They haven't been complaining. They've simply gotten on with their lives as best they can and tried to make the best decisions they can for the safety and well-being of their families. And they've only asked for one thing in return. They've asked for the government to be honest with them. That's what they've asked for in return. But, Mr. Speaker, we know that in key areas, the government hasn't been honest with them. It has released false numbers on hospitalization rates. It has forced people to submit FOI requests for basic, accurate information about COVID outbreaks in hospitals. And even then, it chooses, as we've just heard, to withhold that information. Vancouver Coastal Health said there were no records. That's unbelievable. That is simply unbelievable. And Fraser Health, as we've just heard, blanks out 55 of 79 pages because apparently the government determined that disclosure would be harmful to its, quote, financial or economic interests.
That's what it says.
That's what the material says, Mr. Speaker. Can the Premier explain which possible financial or economic interest of the government justifies withholding accurate, vital and relevant information from British Columbians about the COVID pandemic?
Minister of Health.
Thank you very much, Honourable Speaker. The member, the former government House leader will know from his experience that the reason why information in a pandemic, the definition of information, how it's provided is provided by the public health officer, is for exactly that question and the importance of that question of credibility. It's why we have been so supportive, and I would say overall the opposition has been so supportive of Dr. Bonnie Henry, who is responsible for that. And I just can't let the premise of that question go by. The premise of that question go by when the member says that Dr. Henry and other public health officials are not being honest. Well, I just tell you, I am not in agreement with that.
Members, come to
I
order.
am not in agreement with that.
Members,
Or anyone else.
Continue.
There's an extraordinary effort to provide information about this pandemic. There's extraordinary effort being made to provide information to everyone about this pandemic. There is, as members will know, on the FOI process, there's a process that people go through independently to determine issues of the applicability and whether information will be provided or not. That's the nature of the Freedom of Information and Privacy Act. But I think members know this, and members of the opposition, I say, although I wasn't going to let that statement go by without responding to it, I think members of the opposition have been exceptionally supportive of Dr. Henry as well. And I would never say otherwise, Honourable Speaker, but I would say this, Honourable Speaker, that I think public health has done an exceptional job in providing information to British Columbians. I support them, I'm responsible for their actions in this House, and I'm proud to support them today.
member for Abbotsford West on supplemental.
Thanks, Mr. Speaker. As a skilled and experienced parliamentarian, the Minister of Health can try as much as he likes to deflect attention away from the essence of the question. But he hasn't done so, and he hasn't answered the question. He hasn't answered the question about why, when a request for information about the safety of hospitals, a request that shouldn't even require an FOI request. It shouldn't be necessary to double-check numbers provided by the government, but that is necessary because the government has released false numbers in the past. He hasn't answered this question. Why is it that 55 pages are blanked out and the excuse used is that because it would be harmful to the financial or economic interests of the government? Those are what the documents say, Mr. Speaker. The government, the minister, the premier want British Columbians to trust the government, but unfortunately the government doesn't trust British Columbians, Mr. Speaker. Here's the pattern. Here's the pattern that the minister and the premier don't want to acknowledge. They failed to release a report on COVID-19 in long-term care homes. They failed to provide accurate case counts and hospitalization data at the local level. And they're still failing to provide true hospitalization and ICU numbers, despite promising weeks ago to do so. My question again to the Premier, when will he stop blocking the disclosure of information that British Columbians are entitled to have about the safety of their hospitals, and when will he proactively release the accurate information that British Columbians are entitled to have to assess the safety of their hospitals?
Minister of Health.
Public Health has been providing information through the BC Centre for Disease Control and through the Provincial Health Office from the beginning of this pandemic. And there have been, throughout the pandemic, as is absolutely understandable, requests for more information, and they have consistently met those requests. The number of reports that are made available on a daily and weekly basis is exceptional, beyond anything that's provided, I think, on any other issue in government, because Dr. Henry believes, and because I believe, that people need to know the information about a pandemic that's affecting everyone's lives. And that's what we've been doing from the beginning of the pandemic. They define, and we define information. This is why, when you consistently define hospitalizations, you know that in the first period of the pandemic, the first phase of the pandemic, we topped out at 149 people in hospital and 72 people in critical care. That in the month of April, we hit 183 people in critical care. That's more. That now we're at 151 people in critical care. That's a lot. That we're moving people around the province. We provided details to the opposition and to everyone else about all of that. And we're going to continue to do so. the people leading that effort of getting the information, and this assures public confidence, is the Provincial Health Office and the BC Centre for Disease Control. And that's not a way of dodging the question. I support them, and I'm responsible for their actions in this House, and I'm proud of them. I'm proud of the BC CDC and their courageous 7-day-a-week effort throughout this pandemic, and I'm proud of our Provincial Health Office.
Leader of the third party.
Thank you, Honourable Speaker. Yesterday, this government told my colleague that they view housing as a human right. We agree. Everyone has the right to livable, affordable housing. But in BC, housing has been treated like a commodity instead of a right. In the first quarterly report of BC's finances last month, this government touted a, quote, stronger than anticipated financial recovery and a smaller deficit than was projected. But the numbers don't tell the whole story. Our economic growth is tied to an explosion in housing prices. According to the BC Real Estate Association, prices for all homes increased by 17.1% this year. The increase in prices shows up on the province's books, deepening our government's reliance on an overheated and unsustainable housing market. My question, Honourable Speaker, is to the Minister of Finance. This government has a vested interest in keeping housing prices elevated. They also have a commitment to uphold the human right for everyone to have livable, stable, affordable housing. How does the minister reconcile this conflict?
Minister of Finance.
Thank you very much, Mr. Speaker. And I have to say to the member how much I appreciate her asking the question. As a government, we have been very strong on making sure that housing affordability is addressed here in this province. We've recognized that BC's housing market continues to be a priority for our government, and we've made significant efforts to address that. From a 30-point housing plan, where I believe all elements of the plan have been enacted, most of them have been completed. We've brought in a speculation and vacancy tax to make sure that we can deliver for British Columbians. We've brought about billions of dollars of investment into housing, but not just for those on the bottom end of the income scale, but for middle-income British Columbians, with $2 billion invested into the Housing Hub to make sure that we can also bring housing about for those middle-income British Columbians. Mr. Speaker, we know that the pandemic has jolted the housing market in a significant way. We were making headway on addressing housing prior to the pandemic. We know that there's more to do, and we're a government that's committed to continuing to address housing affordability here in British Columbia.
Leader of third party, supplemental.
Thank you, Honourable Speaker, and thank you to the Minister for that response. And yes, I appreciate what she's identified, the 30-point housing plan, the speculation tax, investments in housing, and the Housing Hub. However, let's go back to the 17.1% increase in housing prices this year. And so the outcomes are not the desired ones if this government is truly committed to housing being a human right. Let's just consider, for example, how many people who work in this building who are struggling to find affordable rentals and for whom the dream of home ownership in Victoria is an impossible one. This is connected to the commodification of housing. Government is overly reliant on housing revenue to display a, quote, healthy economy, but the economy isn't healthy if it's not working for the vast majority of people. Let's remember, GDP measures everything except that which makes life worthwhile. Yes, COVID-19 has impacted the economy and the housing market, but that doesn't absolve the government of its responsibility to act. We're facing a housing crisis. The crisis is deepening. Through you, Honourable Speaker, again to the Minister of Finance. What was not addressed in the minister's response is the fact that people can't afford to live in their communities, nor does it address the conflict that this government appears to be unwilling to acknowledge. Is housing for wealth creation, or is it a human right?
Minister of Finance.
Thank you very much, Mr. Speaker, and perhaps the member didn't quite understand my previous response, given the significant efforts that this government has made after vacancy of the previous government on this file. We have taken significant action. In fact, in our last budget was $2 billion more into addressing that very gap in the housing continuum. That's a government. That is a government that's taking action. No one here is saying that we're done, Mr. Speaker. We have a lot more work to do, and I know that the members opposite will join with us in that work. The fact that we have, just in the last, I think, 3 years, we have 35,000 rental homes in the pipeline in the last 4 years. And that is going to be coming online. We have more to do, Mr. Speaker, and I look forward to working with all members of the House to continue to address housing affordability here in British Columbia.
Member for Fraser-Nicola.
Thank you, Mr. Speaker. From trying to bury a report on long-term care or blacking out key information about COVID in hospitals, the Premier works hard to hide the truth from British Columbians. And now you can add schools to the list. Parents worried if their child's school has safe ventilation are being kept in the dark by this Premier. We've been asking for months for details on which projects are complete, which ones are scheduled, to ensure that children have safe, fresh air in classrooms. Will the Premier commit today to giving parents ventilation information in one central location?
Minister of Education.
Thank you very much, Honourable Speaker. And thank you to the member for the question and for the opportunity to talk about the extraordinary work that our school districts have done as frontline leaders in keeping our schools open, keeping them safe throughout the pandemic. And I can assure this House that that school districts have taken the significant investment that we have made, $87.5 million over the last 2 budgets, $240 million in this budget, to invest in improving the heating and ventilation systems in our schools. And we know, in my riding, for example, of New Westminster, my community, we know that that community school district has increased all of their HVAC systems up to MERV 13s. We know several other districts have done that. We have asked districts to meet with their local occupational health and safety committees to talk about the work that's been done. I know that the leadership in the Vancouver School Board has spoken with many parents about the work that they've done in that school district, and we've asked that they do, in fact, make all of that information available so that it will be available in one central location. We're working to support school districts to do that, and I want to say that school boards and school districts, the work that they have done to support kids and families throughout this pandemic is extraordinary, and we owe them all a debt of gratitude in that regard.
Member for Fraser-Nicola, supplemental.
There is no doubt that the work done by school boards is extraordinary. Those of us who have served on school boards know the work. What we're questioning is the work done by government. This is a Premier who started the school year by hiding details on outbreaks in schools. He said he didn't want to stress parents out. You know what really stresses parents? Not knowing if their children are safe or not. The Premier gave his office a $3 million raise this year, but he's making parents crowdsource work to find out if there are cases in their children's school. Will the Premier provide with the centralized information parents need instead of adding to their stress?
Minister of Education.
Thank you, Honourable Speaker, and thank you to the member for the question. I think that when it comes to the information that is provided, again, we have a very robust system in place with respect to the provision of information to school communities about potential exposures in their schools. That information is recorded on health authority websites, and I want to assure British Columbians, I want to assure families that if your child is at risk of exposure, you will be notified by public health. That is the process. There is a very clear process established by public health when there is a test positive case identified, and that information is communicated directly to close contacts, and potential exposure notifications are listed on health authority websites.
Member for Delta South.
Thank you, Mr. Speaker. Well, Mr. Speaker, this government has been hiding a report on long-term care, blackening out key information about COVID in hospitals, then concealing vital information for parents. And now the Premier is concealing critical Massey Tunnel documents. While the Premier plays politics, the losers are the drivers stuck in traffic for another decade. It's pretty obvious that the Premier is ashamed of his decision to replace a 10-lane bridge with an 8-lane tunnel. He decided taxpayers should pay more to get less, including no rapid transit option, and he's hiding the documents justifying his decision. Mr. Speaker, we had already approved a bridge. $100 million was already spent on it, and the people would be driving over the new bridge next year. Here are some of what the Premier is hiding, Mr. Speaker. Why a tunnel rather than a bridge? Where is the risk analysis? Where is the value for money analysis?
Members.
How much extra is it going to cost to hire the Premier's political friends to build this tunnel?
Let's listen to the question, please.
And will the project stand any chance of getting through a federal environmental assessment process? All those questions and more blacked out by the Premier. Mr. Speaker, my question is to the Premier. Will the Premier release the full report so that people in BC have something to read while stuck in traffic?
Government House Leader. Proceed.
Thank you, Honourable Speaker. And I must say, Honourable Speaker, I do find it fascinating that they're asking for the full release of the business plan around the bridge, which was released. Which was released. But what's funny, Honourable Speaker, is that when they did the initial announcement of a bridge, they had no business plan in place. Not one. They ignored what the regional governments, the regional mayors wanted, which was the tunnel. Honourable Speaker, that's what the local governments who actually have to deal with transportation on a day-to-day basis want in place, Honourable Speaker. They wanted the tunnel.
Order.
It's also interesting, Honourable Speaker, that when the bridge, the Port Mann Bridge, was put in place, they told that bridge, Honourable Speaker. They told that bridge that wasn't part of the deal, and they were looking at having tolls on the bridge over the Fraser River, Honourable Speaker. The Massey replacement, they wanted tolls. I'll tell you what, Honourable Speaker, we've got tunnel vision that a tunnel is the right thing to do. One thing that we don't have that they had is toll vision. So, Honourable Speaker, I can tell you this. We have been working with local government. We've been working with the Port Authority. We know that a tunnel is the right approach. That's what we're building. That's what we're going to do. And the residents of Metro are right behind us, and we're going to get it done. Unlike that.
Member for Abbotsford South.
Thank you, Mr. Speaker. We've heard today about the extraordinary efforts that this government is going to provide FOIs. Let's review some of those extraordinary efforts, shall we? It's extraordinary, the burying of long-term care reports, hiding data on hospitals, hiding critical information from parents, and blacking out of reports. The Premier's list keeps growing. What's extraordinary, Mr. Speaker, is how disturbing this trend is. In February, Mr. Speaker, the editor of the Fraser Valley Current submitted an FOI. The request was for emails between the Premier, the Minister of Health, Dr. Henry, and her staff about COVID-19 situation reports. The Premier took well past the legislated deadline. His staff said they were actively gathering the documents, but delivered nothing months later. The editor has this to say, and I quote, "When a government breaks the law and doesn't start searching for records on..."
Members. Order. I think I'm going to try. Members.
Excuse me, Mr. Speaker, but
members
apparently
don't-
the side opposition did not hear that this was a quote from the editor, so I'll do it again. When a government breaks the law and doesn't start searching for records until months after a request is made,
Members.
it's inevitably more likely
Continue.
It's inevitably more likely those records have gotten lost. End of quote. So my question, how does the Premier expect us, British Columbians, or the press to believe that during a pandemic, his office had zero records about COVID?
Minister of Health.
Honourable Speaker, the Premier, the public, British Columbians, healthcare workers, everyone has lots of information about COVID-19. They have it because we provide it every day. We provide it every day.
Let's hear the answer,
It's available
please.
on the COVID dashboard.
Members.
You know, Honourable Speaker, from the beginning, from March 2020, we provided public information through public briefings on public dashboards. We've responded to thousands, even tens of thousands of media requests. We provided detailed information, sometimes general response to links to everyone, sometimes a la carte to everyone in the population. There is massive response in terms of information on COVID-19. And the result of that has been the actions of British Columbians who have worked together in difficult times to help one another. I'm very proud of the government's response. I'm very proud of British Columbians' response to COVID-19. And I will continue to act as we've acted, to continue to work with everybody in this legislature, continue to provide information to everyone, including, I say with great respect, the member for Cariboo North, who I'm absolutely committed to providing every piece of information about her riding she requires to do her job, and everyone else in this House. That's been my approach from the beginning of the pandemic. And I want to say this, I think all members of this House have shown themselves in good light here. We have repeatedly provided, in advance, confidential briefings to the opposition. They have never been leaked because the opposition has acted in those matters honorably, and I am proud of that. I'm proud of how we've all acted in this House, and I will continue to act that way.
That ends the question period.